and looking at joints. Before we do that, this will follow the packet that you have, with the exception of the first few slides that talk about fractures. Because we've been talking about the skeletal system, and you know the 206 bones, and you know that joints are wherever two bones come together. And so we've talked about like your shoulder joints, we've talked about the sutures in the head. This is just going to give you the different categories of joints. But the first thing that we need to make sure that we do is go over how fractures and dislocations are actually separate. And forgive me for this bouncing around, but I don't have a stand, and this is this high tech video. But let's not get fractures and dislocations confused. Okay. A joint is an area where two bones articulate. And remember, anytime you see arth means joint. We've used the term articulate before. We've talked about articular cartilage. Okay, the term articulate means it's where the bones come together. So whenever you have a dislocation, that occurs at a joint. Okay? The bones are fine, but something happens to the joint. And this occurs when the ligament that are holding the two bones together in the joint gets stressed. So remember, ligaments are made from dense, regular connective tissue, lots of collagen fibers. So what happens with a dislocation is that ligament gets pulled and it gets stretched. And it gets stretched to the point that the bones aren't locked together anymore, and one bone slips out of joint. That's why they pop dislocations back into place. But once you have a dislocation, that tendon, that ligament is going to be messed up unless the doctor goes in and surgically makes it shorter. We've talked about that before. So with a dislocation, the bones are fine. It's just the joint is messed up. When we talk about fractures, oops, that's my finger, sorry. Fractures are actually breaks in the bones themselves. And so we're going to look at these four kinds of fractures. We've got something called a green stick fracture, a simple fracture, a compound fracture, and a comminuted fracture. This is a picture of a green stick fracture. And you should be able to tell from this x-ray that this is still a child, because here is the wrist, which you guys know are your carpals. This is the radius, which is the lower arm bone that lines up with your thumb. That is the ulna, which you know is your elbow bone. And right there is the growth plate. Okay. They still have a growth plate there. If these were adults, you would not have that gap. That's their epiphysis, and this is their diphysis. Green stick fractures happen in children. Because remember, in children, their bones still have a lot of cartilage in them, so their bones are a little bit more flexible. So here's the green stick fracture right there. You can kind of see it from the side. Okay. A green stick fracture is more of a crack than an actual break, because it gets its name from green sticks. Okay. In the springtime, when the trees and bushes start to grow their new branches, if you try to break the branch, it doesn't really break, it just kind of bends. And if you peel the bark off, you'll see that the wood is green. And that's what we call a green stick. It's very flexible, it's really hard to break. And so this is more like a crack in the bone of a child. It's not really a break because there's still a lot of cartilage to it. Some people call them stress fractures. But like I said, again, you can tell that this is a child because you can still see the epiphyseal plates. You can still see the growth plates. Okay. Now, the next type of fracture is called a simple fracture. Okay. With a simple fracture, the bone is broken. However, when the bone breaks, it's not a complex break. You can see here the fracture right there. Okay. Notice the bone is still aligned. There's not a lot of twisting of the bone. The bone isn't sticking out anywhere. And what you have here is this is the tibia, the lower leg bone. That's the fibula. This is looking at it from the back because the kneecap would be on the other side. But in this case of the simple fracture, you can see the bone is broken, but nothing's really shifted. And it's called simple because only one thing gets damaged. The bone is damaged. You probably didn't tear any muscles, you didn't tear any ligaments, you didn't tear any tendons. Just the bone is broken, and it might shift just a little bit, but it's still perfectly aligned. So it's fairly easy for the doctor to go in and replace that. And that's what we call a simple fracture. Then you have a compound fracture. Yeah, you can see here this one was not pleasant. Okay. With compound fractures, it gets its name because there's more than one thing, compound fracture there. more than one thing is damaged. Okay. Unfortunately, you can see that this is this person's foot. This is the tibia. Part of the tibia is there. The other part of the tibia is there. That's the fibula. You can see that the fibula is also fractured. And this bone is actually sticking out through their skin. Okay. Compound fractures are when the bone shifts, and it's called compound because more than one thing gets damaged. Not only is the bone fractured, but you've torn tissue, you've torn muscle. And in this case, this bone is actually coming out through that person's skin. So compound fractures are a little bit harder to repair because you have to realign the bones. Sometimes you have to pop the bone back in through the skin, as they had to do in this x-ray. But simple fractures, the bone breaks, but nothing really moves. So you didn't damage anything else. This is a compound fracture. Not only did that bone really shift, but it is sticking out through his skin. And if you think that one's bad, the worst one you can have is this thing called a commutative fracture. Okay? This is when the bone is shattered. You can see here. You can see how the bone now has little pieces to it. Okay? We're looking at the elbow. This guy broke his elbow. Okay? This is the olecranon process. Okay? And then there is your, what you would call the elbow right there. And so you can see here, this right here is the olecranon. Is the ulna. This is the radius. Okay? This is the humerus up here. But this is your elbow, your olecranon process of your elbow. Okay? And then you can see all the different little bone pieces here. And so a lot of times in this case, the bone is in so many different pieces, they actually have to go in and pin. You actually have to go in and pin the bone back together because something happened to this person, and you can see how the bone just shattered into these little fragments here. And sometimes the doctors have to go in and clean the fragments out in order to allow it to heal. And then they'll go in with a pin or some type of metal traction in order to help fix that bone. So those are your fractures. That's when the bone is actually broken. Remember, a dislocation is when the joints are messed up. So what we're going to look at now will follow along in the packet that you have. So please make sure that you've got these notes. Okay? But with the packet, you should be able just to follow along with the different types of joints that you have. So with your joints, you have three major categories of joints. And again, you can just follow along with your packet, add in what you need to add in. The common names are fibrous joints, cartilaginous joints, and synovial joints. Okay? But the more scientific names you can see are synarthrosis, amphiarthrosis, and diarthrosis. Okay? In the case of your fibrous joints, okay, the formal definition, bones held together by dense collagen fibers, which makes sense. Fibrous joints, sorry it's bouncing around because I'm moving. Fibrous joints let you know they have something to do with fibers. Okay. Well, their real name, because a lot of joints have something to do with fibers, because wherever you have most of your joints, you have ligaments holding the bones together, and ligaments are made from collagen fibers. So you can see how scientists are trying to change the names a little bit to better fit what they really are, because almost all of your joints have fibers. So we now call them synarthrosis joints, and their common definition now is an immovable joint. And so we're going to look at different categories of those. Okay. You then have what's called a cartilaginous joint, and its old definition were bones held together by cartilage. Well, if you think about it, any joint that moves has cartilage. We've talked about articular cartilage, which is a type of hyaline cartilage. So they're kind of getting away from that and calling it an amphiarthrosis joint, which means it's slightly movable. And most of the joints that you're familiar with, when you think about joints with your bones, you're thinking of what's called synovial joints, and their formal definition is bones held together by ligaments, but they actually get their name from synovial fluid. Okay. Most of these joints are what we call freely movable diarthrosis joints. Di meaning they can move in two directions. It's like when you bend your elbow, okay, you bend it and you straighten it, meaning the two directions. It gets its name from synovial fluid. You have these little sacs, and the cartilage, just like the hinges on a door, you have to keep them oiled. You have to keep your joints oiled. And we oil them with a greasy fluid called synovial fluid. So that's where these types of joints get their names from. But we're going to look at them in more detail as well. Okay. So the first one here it talks about is your fibrous joints. And you guys know that the term articulating means to form a joint. So fibrous joints, these bones are held very closely together in the beginning by dense, irregular connective tissue. And I say in the beginning because you guys know that sutures, the joints are not held together by dense, irregular connective tissue. The bones have actually fused together. So these joints basically don't move. So gomphosis joints are what you think of as your tooth sockets. That's why your gum gets its name. And even though your teeth aren't bone and aren't part of your skeletal system, we've talked about how the dentin is actually stronger than bone. And so therefore we consider your teeth sockets to be a type of joint. And so that's why sometimes when you go to the dentist and they mess with your teeth, your gum might hurt the next day. Well, what's happened is your teeth, even though they're not bone, your teeth are actually held in place with little ligaments. And those ligaments aren't used to being pulled and stretched. So that's why your mouth is sore, your gums are sore after a doctor has worked on your teeth. So gomphosis is what we call a peg and socket joint. It's basically your tooth socket. And again, that's where the gums get your name. Now we've talked about sutures. Okay. Sutures, by definition, people say sutures only occur between the bones of the skull, like your sagittal suture, your mandibular sutures, things like that. But some people actually consider the space where the growth plates used to be, between the epiphysis and the diaphysis, to be a suture as well. Okay. But they say, well, that's still the same bone, so it doesn't count as a joint. Okay. But these joints should not move. Okay. You then have what are called cartilaginous joints. And cartilaginous joints, they move, they just don't move a lot. Sorry, those are my fingers. Okay. And so this joint gets its name because it's tightly connected by cartilage. And you have two major categories, what's called a synchondrosis and a symphysis. And so you can see the pictures there. The first one is an example of a synchondrosis, and the second one is an example of a symphysis. But we'll talk about here. Okay. Synchondrosis are your growth plates. Remember, with your growth plates in children, this is found between the diaphysis and the epiphysis. And over time, this joint solidifies. So it starts off as a synchondrosis joint in some people's minds, and it ends up as a suture. But this is the hyaline cartilage that you know of as your growth plate. Okay? And you know that the joint will disappear as you get older and your bone will stop. Okay? And remember, the root word chondro means cartilage. So this joint has something to do with cartilage. Symphysis, we find this, like, for example, where your two hip bones come together. Okay. A symphysis joint we can find between the anterior surfaces of the hip bone. You have a piece of cartilage there called the pubis symphysis. Remember, you have 3 bones on your left hip, 3 bones in your right hip. And where the 2 bones come together in the front, where the 2 pubis bones articulate, we have this really, really thick piece of fibrocartilage. And that thick piece we call your symphysis pubis. And it basically lets us stand up straight. If we did not have this symphysis pubis connecting the fronts of our 2 pubis bones together, we wouldn't be able to walk. And so you don't really want it to stretch because you need your hips to shift as you walk. Okay? But we don't want a suture there, or else our hips wouldn't shift. We wouldn't be able to walk. But if we didn't have this cartilage there, we wouldn't be able to stand up straight. And the joints between your vertebrae, even though you're very flexible on your back, you can move in all different directions. That's a combination of all the joints working together. Each joint in your back barely moves. And that's because your spinal cord is passing, right close to that. So each joint in your back barely moves because you don't want to risk hurting your spinal cord, your nerves in any way. Which then takes us to the group that you're most familiar with. These are what we call synovial joints. Okay. These are your freely movable joints, so like the joints of your fingers, your elbow, your knee, all of those. Okay. And so it gets its name from I'm shifting here. It gets its name from the space between the bones, which we call the synovial cavity. The synovial cavity is an example of a fissure that we've talked about, and ligaments will hold these bones together. And we've mentioned how the ends of the bones are covered with articular cartilage to keep them from rubbing together. Well, like I mentioned before, you have to grease these, you have to keep them well oiled. So our joints have something called a synovial fluid, And that fluid helps lubricate the joint, it helps absorb shock. Now remember, cartilage is avascular. So this synovial fluid also carries nutrients, it also carries oxygen, it basically feeds the cartilage. And at the same time, it helps take away waste products. So let's look at different examples. So you've got this picture here. What you're seeing, this would be, just one bone. This is like of your finger, your knuckle right there. So this is your synovial cavity. And this yellow stuff represents the synovial fluid. This is an actual picture of your elbow. It's an MRI. Here's the humerus here. There's the radius there. That right there would be your synovial cavity. This white stuff that you see represents the articular cartilage. And then the fluid would be in between there in order to keep that joint lubricated. Now, you might have heard of bursitis. Okay. Well, this is just a little information about it. Okay. In the case of your bursa sac, these are structures that contain a fluid similar to synovial fluid, and they're found between tendons, ligaments, and bones. So basically you would have, remember, ligaments attach muscles to bone, ligaments attach bone to bone, and tendons attach muscles to bone. Well, you would have bone, bursa, and then the ligament or the tendon. And it basically, as you move the ligament, it presses on the bursa sac and it releases this fluid, and it makes the outside of the bone slimy, so that as the ligament or the tendon rubs up against the bone, it doesn't shred it. And then we have tendon sheets, which wrap around the tendons and help reduce friction at joints. I don't know if you have this page, this on your fill-in-the-blank notes, so you might just want to jot down bursa, and you might want to jot down tendon sheaths. And if you need to pause this while you're doing so. Now, in the case of synovial joints, since these are what we call movable joints, we classify these joints according to, these types of joints are classified according to the motions that they make. And so we're going to be looking at these four, something called gliding, angular, rotation, and special movements. And the nice thing is you can Google all these and actually see videos that goes along with these. Okay, so this is gliding, this is angular, so on and so forth. Okay. So a gliding motion is just simple movement back and forth or side to side. Okay. So for example, your intercarpal joints. Remember, your carpals are your wrist. So you know that you can bend your wrist up, back and forth, and you can swing your wrist side to side. Okay. That's what we mean by a gliding joint. It basically, you have more range of motion. You know that you can spin your wrist around. You can go back and forth, and you can go side to side. That is gliding joints. We also have angular movements. Angular movements cause you to form an angle like a triangle or a geometric shape of some type. Okay? And so their formal definition is that they increase or decrease the angle between bones. And these tend to have partners. So like flexion and extension go together, abduction and abduction goes together. And so we're going to be looking at different examples of each of these here. So with flexion, by definition, flexion and extension are partners. Flexion, you decrease the angle between your bones. So you bend your elbow, or you bend over, or you bend your knee. So a lot of times when people talk about flexion, they say bend. So you're bending something. Well, extension would be straighten it back out. So its formal definition is to increase the angle. So flexion would be you bending your knee. Extension would be you straightening your leg back out. Or flexion would be like you bending over, and extension would be you standing back up. Okay? So they're going to be opposites of each other. I don't think you have lateral flexion or hyperextension on your note page. Okay? So I think we can skip those. And then we have abduction and adduction. Okay? When you abduct something, you take it away. Okay? When you're absent, you're not there. So by definition, abduction is movement of bone away from the midline. Remember, the midline is your backbone. So this would be like you raising your arm. Okay? You're taking your arm away from the midline. Okay? Adduction, when you add something, you put it together. So adduction would be basically you bringing the body part back to its normal position. So this would be like you raising your hand. This would be like you lowering your arm back down. Or this would be like you kicking your leg out, and adduction would be like you bringing your leg back down. Now, circumduction, you guys know circle means circle, to move around. So circumduction is where you can move your body parts in a circle. And this happens at your ball and socket joints. So your hip bones or your hip socket and your shoulder socket do circumduction. You guys know that you can spin your arm in a circle. That's multiple movements all at one time. You could actually do that with your hip. Okay? And then rotation, you are revolving, the bone revolves. So like you twisting your arm, that would be rotation. Okay? So like you can, anyway, this is rotation. Okay? And that's actually the radius, the top of the radius is a circle. So that's rotation, you're twisting it. And you have what we call lateral rotation and medial rotation. Those are the opposite motions of each other. Okay? So like flexion and extension go together, adduction and abduction go together. You have different types of rotations, but rotation altogether is that you're moving. When you turn your head left to right, that's going to be rotation. Okay? And these are just different pictures. So here's circumduction, that you're spinning your arm around. Circumduction, you can spin your arm in a circle, you can spin your leg in a circle, all that. Okay? Here's rotation, okay? Twisting our arm back and forth, all examples of rotations. Now we have special movements, and they're also going to go together. So for example, elevation and depression go together. Protraction, retraction go together. Inversion, eversion will go together. Dorsiflexion, plantar flexion are partners. Supination and pronation are partners. And then opposition is going to be by itself. By definition, elevation is the upward movement of a body part. And depression is the downward movement of a body part. So you open and closing your jaw, that's an example of elevation, depression. When you open your mouth, that's depression. When you close your mouth, that's elevation. Well, you can also do it with your arms. If your arm is straight, don't y'all just love, this is my office here. When you put your arm this way, that's elevation, but when you drop your arm back down, that would be depression as well. Okay. Now, you also have protraction and retraction. Okay. Protraction is when you move a body part forward, and retraction is when you put the body part back. So that could be like you thrusting your jaw out. You know that you can open and close your mouth, but you can also take your bottom jaw, and go back and forth, back and forth. Well, that would be protraction or retraction. Or it'd be like you taking your arm and moving it forward and then moving it back. So you have elevation, depression, protraction, and retraction. Okay? Or you could do it with your mouth, and I'm not going to show you my face because I ain't got my hair pulled back and I ain't got no makeup on, and it's a Saturday. But open and closing your mouth would be like elevation and depression. And protraction, retraction would be like you taking your bottom jaw and rocking it, forward, backwards, forward, backwards. Now, inversion and eversion go together, and they tend to just be referred to when we're talking about our feet and our ankles. Okay. Inversion is where you move your foot medially, and eversion is where you move your sole laterally. Okay. And so basically, this is commonly called pigeon-toed, and this is commonly like if you're walking like a penguin. Okay. So you're going to see the lovely toenail polish that my daughter gave for me. Okay. But inversion would be like if you hold your feet this way, and eversion would be like you hold your feet that way. Okay. So don't y'all love my lovely feet? Inversion, eversion. Okay. And these terms tend to just be used to talk about your feet. Same is true for dorsiflexion and plantar flexion. Now remember, flexion means you're bending something. Right? Well, your ankle can bend in lots of different directions. Okay? So dorsiflexion is bending of the foot at the ankle in an upward direction, and plantar flexion is bending of the foot in a downward direction. Basically what this means, this would be you walking on your heels. your foot is bent upwards. Okay? And so you're basically walking on your heels. Plantar flexion would be like you're walking on your toes. So your ankle is now bent in the opposite direction. You have planted your foot. So this would be like you walking on your heels, and this one would be like you walking on your toes. Now, supination and pronation refer to movements of the wrist. These are movements of your ankles. These are going to be movements of your wrist. Supination is so that your palm is turned upwards, like, what's up? Your hand's like, what's up? That's supination. Pronation is when you flip your hand so that your palm is facing backwards. So remember, it's normal for us to walk with our palm up. So supination, what's up? That's where your palm is up. And pronation is when you turn your arm so that your palm is down. And then opposition, as primates, we have what are called opposable thumbs. Our thumb has the ability to basically move in all different directions. And so that's the special joint that makes us different from other different primates. Now, you have homework that deals with the joints, and it talks about the 6 main categories. Well, this is what it's talking about: planar, hinge, pivot, condyloid, saddle, and ball and socket. Okay. These are your 6 main categories. The joints that we just looked at, plantar flexion, dorsiflexion, these are movements that you can have of a joint. These are your 6 major types of joints. Okay. In the case of a planar joint, this will permit back and forth, side to side. And so again, that's that intercarpal joint. Okay. That's the fact that your wrist can go back and forth and side to side, like I showed you earlier. Hinge joints are the ones that you're familiar with, like the hinge of a door. Okay. This is your knee and elbow. Okay. It does flexion and extension. Okay. You can bend your elbow, you can straighten your elbow, but you can't rock your elbow side to side. Okay. With your wrist, you can go forward, you can go backwards, you can go side to side. So that's planar. Hinge, when you bend your leg, you can bend it and you can straighten it. But you can't take your leg and bend it in the opposite direction. Then you have these things called pivot joints. And pivot joints are like here's your elbow, there's your radius. Pivot joints, the surface of one bone articulates with a ring formed partly of another bone. So this is the joint that enables you to turn your palms. So this is the joint that allows you to do supination and pronation. So this. Okay. That is a pivot joint. When you shake your head, okay, when you shake your head no, okay, that's a pivot joint. And I'm shaking my head no, like you guys can see what I'm doing. Okay. And then we have condyloid joints. Okay. Remember, condyles are the flat areas. Well, all these things are condyles, but condyles get their name from your ankles and your wrist. Condyloid joints, the projection of one bone fits into the oval depression of another bone. So your wrist bones, your ankle bones, these also fall into the category of a condyloid joint. Okay. Saddle joints would be like the joints of your knuckles. Okay. So the articular surface is saddle shape. Okay. So like one joint is shaped like this, and the other is shaped like this, so they fit together. So it talks about your thumb, but that's basically your knuckles. And your knuckles would also be like hinge joints because you can only bend them one way. Okay, that would be a hinge joint. You can't bend it backwards. And then your ball and socket joints are the ones you're familiar with, your shoulders and your hips. And now we are finished. So this is on YouTube if you need to watch it again. And I hope you guys have a great rest of your day. Thanks for dealing with me.